I'm Dr. David Evans, and I'm Chairman of the League of Friends, and I've also had the privilege of being a general practitioner in Budley for 30 years. I retired some 10 years ago. It is quite clear to me, living in this town, that the most important aspect, or one of the most important aspects of our medical profession is the care of the elderly, and particularly the care of the frail and elderly. Trying to identify their problems, I feel strongly that isolation and loneliness is one of the main problems for our elderly. They don't always admit to it, but it is very prevalent. In addition, it is important to have facilities available so we can recognise their loneliness, we can recognise their disabilities at an early stage and institute appropriate therapy. I think if we take that aspect, I think we can do our elderly a tremendous amount of good. How do you feel, Norman?
Yeah, I agree with that, David. My name's Norman Hawkins. I've lived in Budley now 10, 11 years, thoroughly enjoyed it, and have been a member of the League of Friends for almost all of that time. David, I agree with the comments you've made, but I think that we need, when we look into the future, to try and build a facility here in the town, perhaps within this hospital, that will provide those people that we're talking about, those patients and residents who need help, with a facility that is going to be available not once every 6 months or 9 months, but here, week in and week out, so that the medical professionals can plan the right sort of treatment and contact so that individuals can be brought here to the hospital, if that's the chosen site. And when we look at the facilities that we've got a great deal to be very pleased about. The hospital itself, which is quite spacious, a car park, which is a very rare asset, but we've got a large one. We have funded and supported annually the cost of a purpose-built bus so that the people who need help and transport to come to this facility can continue to use that bus. I'm also mindful of the fact that we have an amazing membership in the League of Friends, and when we ask for support we get it. And I'm very optimistic and hopeful that the medical team that is currently examining the future for Budley will come up with a plan that we can embrace and can encourage our members to support.
I absolutely agree with what you said, Norman. One of the most interesting things for me is the changing face of medical practice and how that affects our elderly. When I first came here, we used all the community beds for acute medical emergencies and some chronic illnesses. But since that time, and particularly more recently, there's been the aspect of centralisation of medical services. And this, I think, is partly economic, but it does offer our community a very high level of medical service. To support that, however, we need to look at the care in the homes, because this is the commonest request from the elderly patient, is to try and have their treatment at home. And the modern concept of instituting this is admirable, and I've seen it in very practical terms very recently, and it really is so different to the times of 1970s, 1980s when we were practicing. But one of the aspects of it which is so important is that this hospital could act as a hub for this facility, and I'm sure that that is the correct way forward in this modern day and age. First bit of advice I would give is to listen to the needs of the community. If that is done, the community will adapt to almost any suggestions or proposals that the web group can make. Consultation is so important. But having taken that in and having evaluated it, it's important to have a thoroughly investigated policy which is in the best interest of our community. In a nutshell, we must diversify in this hospital, but we must diversify in the interests of our community.
But I do think that the work that's going on here in East Devon to pioneer the concept of hospital at home is very important and enormously valuable. And I would hope that that will enable us to be able to become part of a pilot scheme. So if advice is probably the wrong word, encouragement is the word that I would choose to say to Tom and Rick, keep going and try and involve us, because we would all like to be able to make a contribution.
Thank you both very much.